Hi, my name's Sarah Zaman and I'm an academic interventional cardiologist at the University of Sydney, and I'm incredibly grateful and also excited to have received a Heart Foundation Award for my research project, which is targeting prevention of heart disease in women with non-traditional risk factors using calcium scores. So with this award, I'm going to tackle a huge problem for Australian women, that of coronary heart disease, which affects more than half a million Australian women through their lifetime. And so we need to find better ways to prevent this from happening. At the moment, doctors rely on risk calculators, which helps to determine a 5-year risk of developing a heart attack, stroke, or coronary heart disease. But the problem is that most young and middle-aged women invariably fall into low-risk categories, despite a 1 in 3 chance of them developing heart disease. Instead, we want to utilise something called a calcium score, which we can measure on a simple and straightforward CT scan of the heart, and this is shown to be a very powerful predictor of developing heart disease in the future. The other thing that we're going to incorporate in this research project is the use of female-specific, or what we term novel risk factors, and these include things like pregnancy-related preeclampsia, gestational diabetes, and premature menopause, which have all been found to increase the risk of a woman developing coronary heart disease. Then what we want to do is to use the CT calcium score to identify these women with these novel risk factors, and also to help target Aboriginal and Torres Strait Islander women who are also at much higher risk of premature heart disease. And basically our study will help show if a CT calcium score can help reduce cardiovascular risk factors such as cholesterol levels, blood pressure, and then also reduce risk by adherence to a healthy lifestyle. And ultimately, our research will help prevent the large burden of heart disease, heart attacks, and stroke that's currently occurring in Australian women.